I just wanted to ask your consent to actually provide this video for class. I'm a student physical therapist looking to utilize a video, which the camera will be on. So I'm looking to see if I can have consent to record this video.
Yes, I consent.
Okay, hi. I'm a student physical therapist looking to provide what's called a screen, and I would like to perform that screen with you today. Just know I may have to touch certain structures. Is that okay?
Yes.
Okay. So my name is Rammell. You can call me Mel. I go by Mel. What brings you into the office today?
So I used to be a gymnast, and since I couldn't do that anymore, I switched over to running and triathlons.
Okay.
And I've been putting down a lot of volume lately, and I started to notice some pain in my right quad and glute
Okay.
that's kind of shooting up to my low back as well.
Okay. Can you give me an idea of what you would associate that pain as in like a 10 being worse,
Mhm.
one being not so much, where you see that pain is at?
I would say it's around a 3 or 4. It does interrupt my daily work.
3 or 4. Okay, got it. Okay. So before I get over to some of the sensory screens, I would like to do some of the mental functioning. One of the mental functionings, I'm actually going to allow you to perform these.
Okay.
You're going to go ahead and take your hands to the side.
Do you want me to stand up?
No, you can do them seated first because we're going to do the upper body first. Take your
Okay.
hands to the side, and then you're going to go straight up with your arms. Just like that. Good job. And then back down. Excellent. Okay, just do that one more time. Excellent. Okay. So the next one we're going to do, you're just going to take your hands straight up just like this, and then we're going to go up overhead again. Good job. Okay. And now I'm just going to have you perform. One of the ones we're going to have you do is just going to push against me. This is just going to be an upper body strength. Okay. So I'm going to have you push against me just like so. There we go. Okay. No pain, discomfort with that, correct?
No.
Okay. So let's still stay with the upper body side too. One of the things too, I just want to have you do is you're gonna, for the upper body strength, you're just gonna take this arm. We're gonna go straight just like this, and you're gonna push away.
Push away?
Yep, push away from your body, from the midline of your body. Good job. Okay, I'm gonna go on this side of your body. Okay, same thing. You're just gonna push away. Good job. Okay, no pain or discomfort there, right?
No.
That's good. Okay, so for the next thing I would like to do, because you mentioned the pain is in your lower leg, is it okay if we have you lay down onto the table? Then to actually observe how you lay down onto the table too as well. Yes.
You
So,
want me on my back?
okay, yeah, you can stay on your back. Okay, so I'm gonna go on this side of the table. So I'm gonna check your active range of motion by raising this leg straight up above. You can raise it straight up to as far as you want. Okay, any pain or discomfort there?
Yeah, it's tight through here.
Okay, I'm just gonna go ahead and document that. So before we do a touch screen, okay, we did identify pain on the right side, right? Okay. Good job. Okay, so we'll go over to this one too. This is just another gross or large scale movement that we're going to perform. You can go ahead and raise this one straight up too. Now we're staying specific to some of the regions that you're describing on the lower leg.
Yeah.
Okay. So I'm going to put this paper to the side, and I'm just going to do the sensory touch where I actually touch to see if there's any pain. Okay. So it's going to be a light touch. Any pain through there?
Yeah.
No pain through there? Okay. Any pain through there? Okay. What about this side?
No.
Good job. Okay, so I'm going to go into the left side of your body and do the same thing. Any pain through there?
No.
No, through there. And we're just touching it's called the greater trochanter or the front side of the hip, just to see if there's any pain at that side too. And we're staying mainly on the quadricep side or the front side of your lower leg. Next thing I'm going to go is any pain through there?
No.
Light touch to it. I'm going to use my other hand. I'm just going to go right here. Any pain through there?
No.
Good job. Okay, any pain through down here? Okay, but you can still feel that too, right?
Yes.
Okay, good job. Okay, what about through there?
Yeah.
Okay, good job. Okay, that concludes our sensory screen, okay, for the lower body, which you describe as more of a discomfort area. That also concludes our gross motor. The other one that I would like to do is I would like to actually take a gross motor movement, and we're going to grab the knee, we're going to bend it like so. We're going to put that just like so. From this one, I'm just going to have you push down into the table. So you're going to take this one and push it down to the table. Any pain or discomfort through there?
No.
You don't do it?
Actually,
That actually makes you feel better?
yeah.
Okay, that's pretty cool and interesting. which we will identify why that's like that too. I'm gonna grab this one, we're gonna put this right here. Okay, so next you're gonna go ahead and push this one down to the table. Good job. Okay, any pain through it all?
Yeah.
Okay. All right, so that one we just basically isolated each side. So now let's take both of them. We're gonna have you bring these straight up, or sorry, curl them just like that. Now you're gonna do what's called a hip bridge. Just bridge straight up. Good job. Any pain or discomfort through there?
No.
Not through it? Okay, you can take that back down. Okay, so we did identify that there was no discomfort or pain through those movements, right? Through large gross movements. Okay, so one of the gross strength movements that we're gonna do is I'm gonna have you go against resistance, right? And then we're gonna take this one straight down. We're gonna have you push, and this is gonna be for your gluteus medius. It'll also show me a little bit of what's gonna happen at the quadricep. So I'm gonna put my hand on your right malleolus, which is the ankle bone. I'm just gonna have you push against that with as much strength as you want. Any pain or discomfort?
Can kind of feel it.
Do that one, okay? So that gives us an indication that we do have it on the right side against a strength component, like a gross motor, like large scale muscle movement. The right side. Okay, so I just want to document that. So we're gonna take it over to this side. Okay, so now this one's gonna press that way.
Okay.
Okay. Good job, okay? Any pain or discomfort through there?
No.
Okay. Okay, so that's pretty good. Okay, so we did the sensory one, we did that as well. Okay, so now I'm gonna have you flip over to your stomach. This is just another large scale movement. So from here, while you're laying prone on your stomach, I'm gonna have you take both of your legs and you're gonna go into extension.
Like this?
Yep. And let's do it like this. We're gonna lower these two. So the extension is gonna be these lower legs going all the way up to the sky without bending these. You can keep these straight locked out. There you go. Okay. Any pain or discomfort through there? Okay. You feel like you can perform that movement okay, right?
Yeah.
All right. Okay. So let's go have you flip back onto your back. Good job. And now I'm going to do a tendon assessment. So this is just going to be a motor assessment. So I'm going to have you go ahead and sit up. So it's going to be a deep or a tendon reflex because we're going to look for something to see if it reacts. So you can take these and put them off to the side right now. Okay, so one of your tendons that you have is going to be called a patella tendon. Okay, so with that being said, we're going to go into this tendon right. That was cool. Same thing here. Okay. Okay, so these ones you can go ahead and curl those down. Okay, so for that one, those two. Okay, so from there, can you give me any indication of any cardiovascular or pulmonary issues that you think might arise to as well? Any cardiovascular issues in terms of like blood pressure, medication, anything like that?
When I was pregnant, I had high blood pressure.
Blood pressure for pregnancy.
Yes.
Okay, that makes sense. Okay, I'm just gonna document that too as well. Okay, so we're gonna go ahead and conclude the recording, and I'll stop it from here.